Synovial articulations are structures encountered in the musculoskeletal system that allow the articulations to perform movement. These are vital in the majority of the activities we carry on a daily basis, such as performing a sports activity. Unfortunately, these articulations are highly vulnerable to suffering injuries. An injury in the articular cartilage, independent from its etiology, represents a therapeutic dilemma that can compromise in a definitive manner the future of the joint, consequently, the functionality of the patient. Osteoarthritis, the most common articular disease, affects around 25% of adult individuals globally, and it is estimated that more than 80% of people surpassing the age of 60 present symptoms of osteoarthritis in at least one joint. Pain has been defined as the primary symptom of osteoarthritis. Articular cartilage is a tissue that absorbs the impact produced by movement. Osteoarthritis produces a degradation of the articular cartilage, which causes friction between the bones united by the joint, leading to symptoms such as pain, inflammation, and movement restraint to be produced in between the joint. Over time, this friction can cause permanent damage to the joint. Osteoarthritis has been described as a non-inflammatory degenerative condition that is characterized by the implements of articular cartilage degradation and repair. The degradation of the articular cartilage begins with a softening and later the detachment of small fragments of the deteriorated cartilage. These fragments are then deposited in the synovial membrane that surrounds the joint. Recently, the research of the genetic linkages and the innate immune activation in the osteoarthritis further supports a possible pathogenic role of inflammation and a chronic wound repair type of immunologic mechanisms in osteoarthritis. The synovial membrane counts with cellular receptors known as toll-like receptors. The damaged cartilage molecules are recognized by toll-like receptors in a similar manner as that of exogenous pathogen-associated molecular patterns. This unleashes the activation of a cellular process that secretes inflammatory cytokines and chemokine. All of this also produces an increase in free radicals such as nitric oxide, peroxide nitrate, and superoxide anions, which contribute to the damage generated in this pathology. Nowadays, the development of a new oral therapy presents great advancements in the control of osteoarthritis. Acten is a supplement that has demonstrated its clinical efficiency in the control and prevention in the development of osteoarthritis. Acten consists of an oral gel therapy with 1 dose per day. The benefits of the oral presentation through gel are far superior to different presentations such as powder, capsules, or pills. This is due to the biotechnology applied in Acten that allowed the development of hydroatin, a biologic gel, patented and scientifically designed to act as a transport vehicle of the active components, which consist of a polymer that forms a high water content network, low interfacial tension, optimal molecular density, and minimal mechanical strength, which leads to a controlled liberation of actives, protecting them from the natural degradation of gastric acid, allowing the gel to maintain the plasmatic levels for more time, which guarantees a bioavailability of the compounds above the 98%. Acten has 2 main active compounds, the hydrolyzed collagen peptides and fucoidine, a derivative form of Fucus vesiculosus, a brown algae from the Norwegian coasts. Once in the gastrointestinal tract, the hydrolyzed collagen peptides and the fucoidine are deposited in the intestinal villi, where these are absorbed. They travel through the blood circulation to be distributed in the inflamed joints. Once in the inflamed joints, these compounds travel to the synovial liquid where they carry out their function. Fucoidine Having a greater affinity shifts the fragments of the damaged cartilage through the tool-like cellular receptors. Fucoidine is a natural compound that selectively blocks the liberation of biochemical factors that produce inflammation in the synovial membrane, which is the cause of the biochemical process of secretion of inflammatory mediators. Once this process is done, the secretion of biochemical mediators of inflammation are inhibited, producing a natural deflation in the synovial membrane, which causes the pain to go away. When the inflammation disappears, the second active components favor so that the hydrolyzed collagen peptides carry out their process with greater efficiency, penetrating through the damaged articular cartilage and producing an anabolic process of the cartilaginous growth that brings back the functionality to the damaged joint. The job that fucoidine does at a molecular level is what differentiates it and makes Acten superior from any other collagen-based compounds. Since it attacks from a biochemical level, the most dangerous enemy of articular health is inflammation. Acten, health for your joints, the solution at the molecular level.